Clear camera first. Okay. It's really blurry.
No worries, no worries. But thank
okay,
you
as
so
long as
much
people.
for yes, that's all right.
Sorry, go ahead.
Thank you for agreeing to do this thing.
It's okay. Thank you for having me discuss a few of those tips too.
Yes, I saw that you I think on one of the posts you shared about helping others who want to follow the same route as you, or maybe if they have hospital interest or clinical interest. And I said, okay, maybe that's something that you can share to others who may be watching. Yeah, but thank you so much for
That's
making the time.
You're welcome, Doc.
All right. So, with, by the way, are you based in Port Moresby, or are you based outside of Port Moresby, or?
I'm based in Port Moresby. I'll stay a while and then maybe look for some opportunities, job prospects and stuff.
I'm sure you will find something that's will fulfill your needs and suit your qualifications and experience, because I'm sure you will find something soon enough.
Hopefully.
No worries. I already connected the live streaming to LinkedIn. Um, I will just share that again in case um, someone is there and want to
Sure.
join. So I'll just. I think there was and Mr. Looking Up Andrew.
Hmm.
He commented that he wanted to join and was asking for the link. I did
That's
one
okay.
this morning. I did one this morning, but I will go and edit that link and put this one that now we are using. So I'll just quickly put that. And then, okay, that's done. All right. So, well, I don't want to take too much of your time. I'm planning that our session will take about an hour.
Sure.
Um, and we'll follow the outline that I sent. I don't want to make it like a very strict formal interview, but more like a conversation. So,
Sure.
and then we can go from there. And once we finish the live stream recording, will be available for others who will want to see what we discuss. And I think especially your experience, this new experience that you just completed, and opportunities that you identified and want to share with other young PNG health professionals who want to follow in your footsteps. To start off our discussion, for those who don't know you, maybe you want to make a small introduction of yourself before we begin.
Sure. Okay. Thank you, Doc. Thank you, everyone who has joined in and those who will watch later on. I am Titus Pakop. Mom is from Orobe and dad is from CRC. I started my education back in East New Britain province. Did grade 12 and then came here to medical faculty. In fact, I'm here in the anatomy lab at medical faculty. And completed my MBBS. That was after the Science Foundation at UPNG. Did my MBBS, completed it in 2009. Yeah, so 2010 and 2011, we normally go into what we call the residency or internship. That's the training. We have a professional license to practice as training doctors under supervision of specialists. So I completed the training in 2000 2011, early 2012, and I joined ophthalmology. So I did some cataract surgery at Nonga, finished it, and then I joined surgery at Alatau in 2014, 15 up to 18. I completed the first part of my training in surgery, left, joined PIH, Pacific International Hospital, for a year. That was my gap here, and then I joined the training again and completed my second part of the master's in surgery, and I finished it in 2021. Yeah, so that's that. And I'm a general surgeon by profession. And then there was an opportunity. In fact, I applied when I was in my final year of the second part of surgery. I applied for an MBA at UPNG, and I got selected. So I managed to do it within a year, 2022, finished it, worked as a general surgeon here in Mosby, went to Nauru to the South Pacific, worked a bit, 2023, 2024, I got the Fullbright scholarship. So I went to the US, spent 10 months there in Boston, completed the master's in policy, health policy and management. And now I'm back in PNG. So that's a wrap up of at least my academic and my career. Yeah.
Thank you for sharing that. Maybe I'll just backtrack a bit and maybe just pick up maybe your choice into the medical profession as a choice of a career choice. What made you choose that route?
Sure.
I think some young people may be wondering and thinking to follow in that steps.
Okay, good. Well, mom was a CHW, so I literally grew up
Right.
in the hospital too. Followed there. We went for what they call the immunization exercise. So we go into the rural areas, visit small kids. That was back in Kundiawa. That's Chimbu province. So I really enjoyed those times. So those memories kind of shaped me, molded me to take up the same career pathway as mom. My big brother too is a medical doctor with a wife. So those are the type, I mean, the influence, the family influence that I was exposed to early on in life. So that kind of shaped my career path, led me to this, to take this vocation.
I see. And going into surgery, is that something that you always wanted to do or something you decided while in medical school?
I wanted, yes, I was more into internal medicine. I think I found that it was my thing, but a few years into the residency training, and then I wanted, I thought I should take another challenge, which is surgery. So I chose to do surgery. So
I
when I
see.
was in high ophthalmology, I did those microscopic surgery. The eye is a very delicate organ. So, and then that kind of led me into that path where I am now, general surgery.
I see. I see. And many, like even from my own experience, most doctors after specializing wouldn't consider an MBA initially. What was the what was the motivating factor there to do MBA soon after qualifying as a surgeon?
I mean, like for us clinicians, like I feel like we are being confined into the hospital setting, and most of what we do is basically dictated by people who control a lot of, like financing and where to put the, limited resources and stuff like that. So I wanted to understand more how I, as a clinician, can inform management, or even policy uh, for my field. Surgery, it doesn't gain a lot of momentum in terms of, funding and being put up there as a healthcare priority and all those things. So I was just thinking, like, is there any way that I can venture out of the four walls of the hospital, gain some insight into what can be done to at least um, make way for those finance, uh, the resources to trickle down into my specialty. So that was the driving factor. And I mean, going back a few years back, uh, the Lancet Commission, which is part of, I think, WHO Global Fund, they came up with the Lancet Commission, and their main goal is to prioritize global surgery and push surgery down, at least into the district level. So for us, we are categorized as a low to middle income country. So we are part of that movement. So I think for us, like other specialties, they have their whole movement going on, immunization, HIV, TB, maternal mortality. But for surgery, that's where it's really lacking. So I thought I would do a little bit further than what's been done in the hospital. So that's why I took those kind of courses that will at least give me an insight, a better understanding of what's happening outside of the hospital, and going a bit upstream, going out into the communities, instead of being just there, sitting there, waiting for, cases to come, and you have no effect, and you have no influence on determining or dictating what comes to the hospital, or what you stop in the community, or you prevent in the community. So those were a lot of things that led to me taking up all those more like management courses to at least think holistically about health. Yeah.
Yeah, you know what? I mean, you are striking something that I also see as I really needs a mindset shift from doctors. I mean, I came through the same process as yourself, and I could also see where our training is really meant to be as training to be a specialist in a hospital, and even though we learn the theory of what causes a problem in the community and how it ends up at the hospital, our training is geared towards a pathway that sometimes you feel you have no control over, and you at a hospital where and you feel that you are being drowned by caseloads and things, and you want to do something, but that avenue to expand maybe training or perspective or mindset change doesn't occur easily. And if you do, you will sometimes find yourself going off in a tangent, and maybe creating a new pathway for yourself. Uh, I mean, um, does that my little analysis kind of resonate with maybe what the pathway you have taken?
Oh, definitely. Like, in the clinical setting, especially in surgery, established subspecialties, orthopedics, neurosurgery, hepatobiliary, cardiothoracic, and stuff like that, pediatric surgery, yeah. And like that's within, our country. But when you look at it overseas, even general surgery is a subspecialty of its own. So if you're a general surgeon and you want to subspecialize, you can do laparoscopic surgery. And if you go into robotic, which I'm also a very, what is it? In fact, I've started my laparoscopic training already. So that's the clinical part. If I ever decide to go down that path, I will. But if I want to go policy way, then I've also created my pathway, which is going to go through global surgery. So global surgery is, as I've said, it's a global movement, especially in the low to middle income countries, and it doesn't get any more, significant momentum in our region, which is the South Pacific region. So I've managed to talk to a few of other Fulbright scholars. One of them in the US. We talked about it. We wanted to do some, collaborative work and stuff like that in terms of research in surgery, global surgery specifically, to drive the movement here in PNG, Solomon Islands, maybe Vanuatu, and see if we can go further southwest or southeast, should I say. Yeah,
Yes.
so that's
Thank you.
yeah, that's more like you know, those niche areas of, you can say, clinical specialty, or you can say, you know, you want to get involved in policy and drive those global agenda forward. So those niche career niche careers or job markets exist. Yeah.
Thank you. I'll maybe jump onto your Fulbright training and pathway. Can you also? I think maybe
Sure.
others will also want to maybe know more about what the Fulbright scholarship is, how they can apply, and also as well as share your experience, what got into doing that, and yeah, just share that experience with us if you don't mind.
Sure. Okay. In fact, I applied. Uh, when was that? 2023. So it was like I was here. I'd like to say that, you know, when you are in the thick of things like you gain momentum in your education and career, you have to continue, because like for us, once we leave the classroom setting and we come out into the workforce, we kind of get a little bit rusty and impatient sitting down in the classroom. So I was kind of like, straight after I did a surgery, master's in surgery, went to do an MBA and stuff like that, I was in that momentum. I had that momentum going forward for me. So I just decided that maybe it's time for me to, you know, pursue all my education interest, and then I can put a, maybe say, a pin on it, and then start working and try to impact some changes. So that was the driving factor. And also in terms of surgery, I saw that the trauma cases, every time we go into theater, we see that the trauma cases are the ones like bush knife injuries, bush knife wounds, gunshots, motor vehicle accidents, and they always come and disturb our normal schedule, operation schedule. So I was just thinking something has to be done about the trauma cases here in PNG, and our people, like, we kind of become violent from time to time. So I was just thinking, if I can do something in that line, try and stop, at least minimize trauma cases from going upstream, trying to stop that, then we will have less trauma cases coming to the hospital. That was my the driving factor that actually led to my, what we call a statement of purpose, which I will touch later. Where when you want to apply for Fulbright scholarship, you will write that statement of purpose and then the study objectives and stuff like that. So I wrote it to according to my clinical experience, what needed to be done to at least cut down on the trauma cases coming in. So that's basically the driving force that led me to apply for the Fulbright scholarship. When the date opens, you just have to click onto the portal. They will give you a portal, and it's sequential. So you just fill in. You don't have to do it in one setting. If you want to apply for it, you don't have to do it in one setting. You can do it over a couple of weeks. They give ample time for you to apply, and before you can even apply for the Fulbright scholarship. So let's just break it down first. Okay, so Fulbright scholarship is, you can categorize it as it's external funding, right? So if you want to self-sponsor, then you have to save up and to go to the US to pursue a graduate diploma or master's or a PhD. You have to save up a good amount of money before you go. That's one way that you can do. The second one is for you to apply through what we call like colleges or institutions. If they are fully funded, they will fund it. They will give you all the funding. And then, of course, the third one is this Fulbright scholarship. And if it's for, the UK and stuff like that, they have Chevening, and there's a lot of other scholarship, Commonwealth scholarships, and all of them are available. And then You also have loans, student loans. Our DS Department of Higher Education, Research and Science, it's giving out loans, which you can also explore, but the maximum is, I think, for master's level is 15,000 kina. PhD, it's 20,000. So that can also be, you can use that for your maybe groceries and stuff like that. But there are other ways that you can explore, like for African students, they have what they have empower. So that's a very good initiative. It's a global initiative. I think that they access those loans. They budget for their entire like tuition, their housing, off-campus housing, their day-to-day living, and even after they complete studies, you have to have a little bit of money to just transition into a new job, and your job is not guaranteed. So those are the things you have to budget for. So you can do that through the loans, you can do that through the external funding, Fullbright, Chevening, or Commonwealth Scholarship, or if you decide to go down to Australia, there's Australian Harvard, stuff like that. And then what's the other one? Sorry, just let me have a look. Personal funds, if you have enough money in your bank account. And for, especially I think for PhD students, they have graduate assistantships. So you have to communicate directly with professors in those institutions that you are interested in. And for you to, and once you communicate with them, you establish connection, a good rapport. They want to take you on board. They offer you a job like that. Then through that, you working as a teaching assistant, they will reduce your tuition or they will just let you go in free without paying the tuition. So those are the pathways that you can get in. Now, in terms of universities, so first and foremost, as I've said, for me, my interest was in trauma, and that's the driving force for me. So when I thought when that the idea of pursuing a health policy came into mind, I was checking out which universities are the best. They offer the best training in health policy. So I started, making a short list of them. A couple of them, at least I went to five. I did a research on my own, and then also you have to see if, as I've mentioned already, in terms of if they give you a tuition scholarship, because if they offer tuition scholarship, like for me, for Brandeis, I went to Brandeis, which is a private Jewish institution. They offer 70% tuition scholarship. So that means that Fulbright, which is the external funding, pays only 30%. So that kind of, for Fulbright, that kind of left them with a little bit more money, maybe to get another candidate on board in the Fulbright scholarship for PNG. So previously they used to send at least 1 to 2 payer, but for a lot they sent 5 of us, because I think a few of us were on the tuition scholarship from the universities themselves. Okay, so that's how you can access funding. I think financing is one of the most difficult things that prevent students from at least considering pursuing such training overseas. And what's next? That's that. So once you research those institutions, you come up with your short list. You identify which university is suitable for you, and they offer scholarships, and you look at it from your own perspective as well. You have enough savings to meet the balance and stuff like that. You do your own calculations, and you must also have your own little, maybe the spreadsheet or something like that, that you keep track of the application due dates and how much the tuition fees are, and the ranking of the university or the ranking of the specific school that you want to go to, The faculty, are they supportive? Are they in line with your expectation, your cultural background? You want a little bit of mix of, students from all over, or you want to go to a state where you want to mingle or integrate yourself in the more like a predominantly white society, or such. If you have some things that may force you to live down south where it's a little bit tropical, or you go further north where the winter is a little bit harsh. Those are the things it's up to every individual to uh, to assess it for themselves. But at the end of the day, funding and your interest. You don't want to be going there just because of funding, and you do something that you are not interested in. You come back, you might not find it like motivating to carry on in that space. Yeah, so that's that. So after you are done with selection of whatever institution that you are interested in, maybe make a list up to 5, 6. May ensure that at least you have some funding available through those 4 different means that I've said already: student loan, personal savings, uh, external funding through scholarships, and if you are applying for a PhD, you can apply to be a teaching assistant or graduate assistant, research assistant. So those are the 4 venues that you can settle your funding issues and the school. And then you will have to make sure that you have all your certificates on hand. Transcript must be updated. So I don't know about the other universities here, but at UPNG, when I was trying to update my transcript, it was a little bit difficult. So you have to do it in advance and have it printed out, get them to sign it, seal it in an envelope. What else? Then they will also ask for what is it? Referees. So deciding referees is very important. You have to decide, not just because someone is like a professor or a senior lecturer or a senior colleague, but someone who will speak for you. Because what you don't want to happen is that you get someone who's very senior, but who is not really going to lobby for you, because it's going to be the conversation between them and the faculty, your professor in the US, potential like uh, university admission or officers. So you have to get someone who is really going to lobby for you. And then to get things out of the way as well, you have to sit for those, they call it the English proficiency test, like TOEFL or IELTS. I did mine, it was like Duolingo. So those are the 3 types. You have to just sit for them, get them out of the way. And if you are planning to go for further studies in the next 6 months or 1 year, you have to see how long, like I'd say, like life expectancy for those certificates. Is it 6 months? Is it 12 months? Or is it going to be valid for 2 years? So you choose which one in particular that university wants as a requirement, as an English requirement for you to gain admission, and you sit for it. If they ask you to sit for what they call a GRE, just get it out of the way. It costs money, but if you plan it over a duration of, say, uh, 12 months, you can slowly do it without any hassle at all, no stress, no pressure. And as I've said, some of us that have been through the system, we can always guide you along, and just give yourself 12 months to plan for the next cycle of scholarship and admission. So don't be harsh on yourself. Okay, so that's with those entry requirements. And most importantly too, during your research on which university to go to, which course to go to, which professor to approach, you can, in fact, like, that's why we have LinkedIn and maybe Twitter, X now. You go online, go search those schools, sets the universities, and then we go to the schools, and then you click maybe on people or faculty and stuff like that. You identify exactly which professor or who's the coordinator of that particular course. May say, for example, my coordinator is Professor Nanda Kumar, and he's the head of global policy and management in Brandeis. So I have to do my own research, know him, send him a courtesy email, say, Prof, I'm like this and that, I'm interested in this. You establish communication. So when everything is ready, and time for selection and stuff like that, and you just give him another follow-up email. I know this guy, things like that. So you do those things. You lay the foundation, do your own little groundworks, and when the time comes for the application to open, you have all the paperwork ready. You have established connections. You know what you want. Send everything in there. So that's basically it. If I had missed anything, then
yeah, well, thank you so much for sharing those insights. I think one of the mistakes that I see most young health professionals and maybe other professionals who are looking to do studies internationally tend to, when the application is open, then they start rushing, trying to do the application. But I think the key messages you are saying is plan ahead, give yourself maybe a 12-month timeline, do your research on your own interests, make connection with the universities you want to go to, especially the professors in charge of the department and the course or the program that you are interested in. Have some of your own finances ready, look for the specific scholarships, and then you can start your submission process, and being aware of certain requirements such as the English test, the other tests you mentioned, and also our own challenges in terms of getting our own the transcript from our institutions. Some institutions are easier. I know UPNG is like, it can be a challenge to try and get it. So give yourself that leeway of time to get it over. So thank you for sharing that. By the way, for those, in case someone is new and hasn't heard about Fulbright scholarships or Fulbright scholarships, for international students to go to the US to do studies, for exchanges, for trainings, and also in the reverse, where other US professionals and faculty can also go to other countries. But in this case, Dr. Pakop was supported by the Fulbright scholarship to go to in US. And did you say you were at Boston? Can you share a bit of that your US experience and some key things that you learned coming from PNG to US?
Sure. Okay. I was, in fact, I've chosen to go to two other universities, but our post here, the embassy, they placed me at Brandeis University. That's just outside of Boston. It's a small campus. It's a privately run university, Jewish university, and they are also like they are well renowned with the school that I went to. It's a Ella School of Social Policy. They're in the top 10 by US News. So those are the type of rankings that I also looked at. So when they said, okay, Titus, you're not going to, initially they were going to send me to Illinois or what's the other one, Nebraska, and to do public health, but then that's 2 years. Just as well, they sent me to do global health policy and management, which is 1 year. So I have to come back to, so it's kind of, it's a win-win situation. Looking back at it, I was getting a little bit bored, homesick, staying. Yeah. So Boston, the economy is basically dependent on healthcare and education, higher learning. So there's thousands of university students, college students, and then you talk about the healthcare. It's very well organized, but it is so much complexities within that. It's more like when I'm how do they call it? Organized in chaos or something like that. Yeah. So even though it's really, really well set up in terms of the healthcare there, for you to gain access to it, it can be a real challenge. That's Boston. So I'm saying that because I got sick there and I tried, being a surgeon myself. I was diagnosing myself. I know what's wrong with me. Yeah. So I went to the clinic, the university clinic, and they was running tests, delaying my referral and stuff like that. So it was not so much of a pleasant experience, but at least I know what was wrong with me myself, so I was self-medicating as well. But never mind that. When you're the first thing that for us Papua New Guineans or people from this part of the world, that you go to those new places out there, yes, culture shock will be there. Also the diet, the food is the most it's the biggest difference. So I had to get used to the type of food I eat there, and then eventually find my own things, the food types that I'm familiar with here in PNG. It goes a long way. It goes a long way because you have to eat well, you have to sleep well, and then you study. Those are the little things. In terms of safety, Boston is one of the most safest place. A lot of educated people and a lot of students. So you'd hardly run into any problems. You walk around at night. You do your running early in the morning. So self-care. You look after yourself, and then you just concentrate on study. Go back and forth to school. Have your own leisure time, free time, travel. They're beautiful places to visit. So if there's any, like, I'm gonna lobby for the state that I went to, Massachusetts. That's where for healthcare, higher learning, there's no better place than Massachusetts. So if you're thinking of pursuing any training in healthcare, Massachusetts should be first on your list. And as I've said, maybe I didn't state it previously. You have universities, uh, institution of higher learning that it can be categorized. You can have those ambitious ones. You go for the big guns like Harvard, MIT, maybe even gonna Yale, Princeton, Stanford, all those ones, Caltech. You put them as ambition. There's no sin in doing that. And then you put the ones like the most achievable ones, maybe two or three of them, where you can try uh, to aim for, and then the most realistic one, like if you miss the stars, you fall on. When you aim for the stars, if you miss the stars, then maybe you fall on the moon or fall on the clouds, something like
Yes,
that.
yes.
So if you put it like that, like three, 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 and you send your application, you have some money set aside to pay for those application fees. You see that you want to try those big guns too, go for it.
Yes.
There's nothing wrong about it. So that's Boston.
Thank you. You touch on something that maybe like I kind of resonate. That's the navigating a health system that you are not used to. I mean, our system is hard enough. I mean, you and I are in the system, so we know the inner workings of the system, so we can easily navigate others who are, when they made first contact with, say, at the outpatient setting. With my experience in, like, firstly in Japan, where my son was sick, we had to go to the clinic in the middle of winter storm at 1 a.m. in the morning. It was, again, with language barrier and trying to navigate the symptoms, and even doing the paperwork. And then my experience at Ponepe in FSM, just learning how to navigate system. And now I'm here in American Samoa. It kind of models that the system is modeled after the mainland US system. So one of the main thing I realized is if you don't have health insurance, it's going to be a big out-of-pocket burden. And I think for us in Papua New Guinea, we complain a lot about the system, but when I stay here and I look back in, our people are still very privileged on having a system where they don't pay a lot and they can still access basic services despite our many challenges. And maybe just to close off this part of the conversation, in one sentence, can you share how has the Fulbright experience shaped your vision for PNG healthcare?
Okay. Well, there's a lot to be done. There's a lot to be done at all levels of healthcare, obviously. I think the focus for us now, I don't know if it's systemic or it's structural, but the focus is more on the curative aspect, and more of the funding is stuck at the, I should say, provincial hospital level. So if you can see like the PHAs, they are really investing into those provincial hospitals now. For me, as a global surgery advocate, I come in where the district hospitals are at that level and going down, or if you can say going upstream into the communities. So, like, hopefully, what I'm just thinking is, I hope there will come a time when all that needs to be done for the provincial hospital is done, and then we can focus and go further upstream into the district and the community outposts and stuff like that. And then we will carry out the same initiatives, like especially with primary healthcare. Primary healthcare, we roll it out into the community. And the one thing that I think at the Fulbright, I was fortunate to be one of the awardees that went and learned, is that for a community as diverse as Papua New Guinea, I think it has to be community-led. If you're going to roll out the healthcare system down into the communities, the community has to be engaged properly, and they have to be active stakeholders, so that we have to roll out the programs down to them and involve them in primary health care or public health uh, initiatives, water project, sanitation, toilet, and stuff like that. How to do it best. Those little things. Healthy Island concept that I think NDOH has been running for some time, stopped and started it again. Those basics have been around for a long time. We don't need to reinvent the wheel, but we just have to fund it. That's what I think, because most of our focus is just on places where it's the minority go to receive their care, which is obviously provincial hospitals. But the majority, district level and down, not all the cases, say for example, not all the illnesses will need care at provincial hospitals. They will need treatment. They will get better at the level of a district hospital, and then they will go home and continue with their livelihood. And if we have better roads and we have better economic activities, they get back into those activities and they contribute to nation building in their own places. So those are the things, like we keep our people where they are, instead of coming into the cities looking for services, healthcare services, spending more money. When they have done no money, then they won't make it. They will not be able to make it on time, and then delay in accessing healthcare is one of the causes of morbidity complications due to illnesses or death. So that's what I'm thinking. Like, if we can go upstream, the focus should be going upstream, and going upstream, all the programs must be aligned, going upstream, and at the same time, not just achieving individual KPIs. Say, for example, if a donor, NGO, or any other organization is just focused on getting one thing done, we want to reduce the prevalence of a certain illness. There's no wrong in doing that, but the question is, are you also strengthening the health system as you go upstream? Does your program fix laboratories for other patients to benefit, the spill-off effect? Does your supply chain provide medication or assist the provincial pharmacist bring medication that have a high turnover rate, and those are the things like. And does your program help the PHA roll out its vaccination exercises? So if you're gonna go upstream, go after your KPIs, but also try and strengthen the health system, make it robust and make it more tangible, more permanent and sustainable. Yeah.
Yeah, Doc, you touch on something that, I can completely resonate. And I think I've been also, been advocating with, professionals like yourself and others who are in a position to, make a decision within our health system. And that is then one word you use, upstream. That's a word that I learned while doing public health. As being
Yeah.
our training is within this biomedical model of health, and we are not really trained to think upstream and get to the uh, head of the problem. And we kind of learn a little bit, but we fall off along the way as we kind of uh, pursue this other training pathway that sometimes um, some forces at play that we sometimes don't have control over. And the word is upstream. And you touched on a very important point. And I had Dr. Malao here with me a couple of weeks ago, and we were sharing the same point that um, we don't lose sight of the aid posts and the district hospitals while we're trying to make our provincial hospitals better. uh, our system is now kind of giving the PHS system is giving the decision making and everything else that goes with it, um, to make an impact at the provincial level. So really, they should be pushing the services out to the periphery. Uh, the danger is if they start investing centrally, then you kind of again you're creating a pull factor, and people may have
Mm.
problems in terms of transport and money and things to access the services. And thank you really for highlighting that, which is a message that I think us who have done that training, our mindset is kind of now have a blended view of the biomedical model, the ecological model of health, and really talking upstream. So thank you for pointing that out, and I'm sure uh, that when you get a chance, you will through your global surgery initiative really drive that initiative at post and district level, or community health post now as it is called. We are kind of maybe slowly winding down our conversation. Again, for those who have just joined, I'm talking with Dr. Titus Pakop, trained as a surgeon in PNG, then completed his management training MBA in PNG, and has just recently returned from US on where he was training under a Fullbright scholarship. And we're jumping on to some maybe a rapid fire before we kind of finish off some personal and engaging kind of wrap up. So first question is first surgery you ever assisted on?
It has to be appendicitis. Yeah, I think everyone starts off with you know, you see one, you assist one, and you do one. I think that's
Yeah,
the
yeah,
main
that
thing
was
that,
that was
yeah.
the mantra. See one, do one, and
Assist
teach
one.
one.
Oh yes.
Favorite PNG food you missed while in the US?
Like I think all the garden food, yeah, taro, uh, pumpkin tips, all the greens, aupa. Then
The
what
food
else?
that we
No,
sometimes don't want to eat, but we miss it when we are done have it.
of course. And then creamed with coconut, coconut milk, coconut cream. So I really miss those food. Yeah.
Yes, yes. I'm laughing because I wasn't in that situation. Okay. One book or quote that changed your mindset.
Okay, let me see. I think I've quoted that already, but I must have misquoted it. It's something like you aim for the stars, and if you miss the stars, you fall on those clouds or something. Yeah, so that's basically that. Aim high, shoot low.
Yes. All right. And finally, can you finish this sentence? The future of rural health in PNG is...
Okay. It's community-led, technologically enabled, and it's financing.
Yeah, I like that, community-led. I think that's kind of, yeah, I think that should be and take-home message. So thank you so much, Dr. Pakop, for sharing. We kind of started late a bit, but we finished on time. Again, thank you for taking the time out to share your experience with. Maybe we had a few people that were watching, but the live stream will be available later for those who wants to want to have maybe play on repeat and hear some of those details again. And they can connect with you through your LinkedIn page, and maybe they can go from there. So, yeah, Dr. Pakop, once again, thank you so much for taking your time to share your experience with me and those who were watching through YouTube. So, yeah, thank you. And maybe we can do it again for some other thing sometime. And I
we can do that again.
Yeah, I wish you well. Wish you well in your next endeavor in PNG. So, yeah. I'll be following you on your LinkedIn page, so we'll keep in touch.
Yeah, thanks, Doc. I think there are a few others, like we can talk about the clinical training, the requirements. I think one of our other colleagues, Dr. Hanet Katalu,
yes,
she's gone through the I think USMLE and stuff like that to gain entry into the US practice. So she's one of those assets that we can tap into. Yeah. And then for the nursing, I have other African nurses that went through this pathway, so I can talk to them and get some insights and help maybe try help all the different cadres of our profession, specifically nurses and doctors. These ones we are talking about is more non-clinical staff.
Yes.
So maybe later we think
about something that we can. Why not? Maybe let me. I'll contact you, and then maybe we can do a second session like this, and that's focusing on clinical training for health professionals who want to pursue specifically clinical skills training. Yeah,
definitely. We will get some PowerPoint slides prepared. Do it properly. Share it on the screen for that.
Oh, it sounds good. Okay, Doc.
All right. Thank you, Doc.